Okay guys, so our first topic in anatomy would be the head and neck anatomy, in which we would be first seeing the basal skull foramina and its content. So before starting, we'll just look at the basics that the base of the skull is divided into three parts: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. Further, let's start from the beginning. That the first foramina we have here is foramen cecum that contains emissary veins. How we can remember this? So the foramen cecum contains an E in it, whereas emissary vein also has an E, so E for E. Further, the second is anterior ethmoidal foramen and posterior ethmoidal foramen that contains anterior ethmoidal nerves and vessels and posterior ethmoidal nerves and vessels respectively. The superior orbital fissure, on the other hand, contains the cranial nerve 3, 4, 6 and ophthalmic branch of cranial nerve 5. Foramen rotundum contains maxillary nerve. How we can remember this again? So there is an R in rotundum and there is an R in maxillary vein as well. So R for R. Rotundum contains maxillary nerve. The next is foramen ovale that contains male structure. So what does male structure stand for? So here is it. The first M stands for mandibular nerve, A accessory meningeal artery, L lesser petrosal nerve, and E is emissary veins. So how we can remember this? Male passes through ovale. Male passes through ovale. This is the mnemonic we would be using. Then we have foramen spinosum that contain nervus spinosus and MMA. So how we can remember that? So the mnemonic for that is spin MMA. MMA, that is middle meningeal artery. The internal aquestic meatus contains cranial nerve 7, cranial nerve 8 and labyrinthine artery. Then we have the jugular foramen. So for the jugular foramen, I have a separate diagram here. This is the jugular foramen. It has, so the following are its content. The first content is the inferior petrosal sinus, the sigmoid sinus and three cranial nerves, namely cranial nerve 9, 10 and 11, in which we have a separate dural sheath for cranial nerve 9, whereas the dural sheath for cranial nerve 10 and 11 are the same. So this was jugular foramen. Further, we have foramen lacerum that contains greater petrosal nerve. Then we have hypoglossal canal that contains, as its name suggests, the hypoglossal nerve. And then the biggest of all, the foramen magnum that contains, the mnemonic for this is cam vamps. What does cam vamps stand for? The cruciate ligament, apical ligament, membrana tectoria, vertebral artery, A for anterior spinal artery, M for medulla, P for posterior spinal artery, and S for spinal accessory nerve. So this was in whole the basal skull foramina.